You know, the healthcare industry has always been very confusing to me. You know, just for like instance, last week I had a doctor's appointment. My appointment was for 8 o'clock in the morning, right? And I didn't see my physician. She didn't come into the exam room until 8:45. I was the very first appointment. I don't get it, y'all. That's confusing to me. Maybe it's just that my provider just didn't have it together that day. You know, but then I'm thinking about how do people pay for their health insurance? Or even for the people who don't have health insurance, right? So, like the Medicare A and B has always been confusing to me until I realized, well, it's pretty simple when you think about it. So, A is for the hospitals, B is for the doctor. And then they want you to have supplemental insurance. So whether that be like Humana or Blue Cross, Blue Shield, or whichever one it is, they do want you to have a supplemental. You know what I am finding out? It's not that I'm sick. I just need a translator, if you know what I mean. Yeah, because it's all very confusing. I guess I'm just not the one that, for you to come in like wanting the right answer, because that's not me by any means, believe me. This is more of a video of how I find it really confusing. Kind of like my doctor says I'm fine, but my insurance says, well, hold on, let's just not jump to conclusions. You know what I'm saying? They might have to add on a few things there. So I guess that's just, I just don't get that. So, it's almost like, have you ever had like your insurance or even like your doctor's office makes you feel dumber than your diagnosis? So I am very fortunate. I have very good health care. I am very fortunate compared to a lot of people. I don't have Humana or Blue Cross or any of those other supplementals. I just take care of it. I don't know. I don't take care of it. My insurance company takes care of it. I go in, I pay my copay. I don't see a bill. I don't. Thank goodness. Look how many people that do see bills, and then they're caught up and they could lose their homes or all kinds of things just because of medical bills. And then I get to think, Switzerland, or, there's quite a lot of countries out there that give their people free health care. Ours isn't one of them. I don't know. Nobody likes the cost of health care. Nobody. That goes for us, or, the higher people or the politicians, or I don't know who it is. Obamacare. What is that? What was that all about? I don't know. Did it raise our insurance? Did it? It's just all very confusing. It really, truly is. I thought, well, I would just go on and I will Google, Medicare Part A, Part B, and why we need supplemental insurance, and it just doesn't make any sense. It really doesn't. I thought that as I retired, things would get easier, and they just kind of get harder. I just feel really bad for the people that can't afford the health insurance that they need. That's just terrible. I think as a country and whatnot, we should be able to take care of our own. You know what I'm saying? I think the politicians or whoever it is, they need to step up and start taking care of their own. That includes like a lot of us seniors. We work for 45 years, 50 years, and You know, why? I just don't think we should be worried. As the older generation, we shouldn't be worried about where our health care is coming from, or who's going to pay for it. Or I guess I think we should just take a national poll. Let me know what y'all think. Holler at me, right? So I think anybody over 55 should just have automatically free health insurance. But that's not the case. Now, your insurance company could pick who lives and who dies, or who gets the care and who doesn't. And why do they get to pick that? I don't think that they have that right. Nobody should have that right. You know, we just need to start taking care of each other. I just don't get it. You know, I did make a little bit of the list, and I don't know. My list just didn't help me a whole lot tonight, y'all, because it's just confusing. It is. Now, if I was to go into my doctor's office, say 15 minutes late, they would want me to reschedule a 24-hour notice before I counseled, or they would charge me. But my doctor was 45 minutes late. You know what I'm saying? So I don't get that. I don't understand. If she's 45 minutes late, she should pay me, right? I don't know. I think my time is worth money just as much as their time. You know, 8 o'clock in the morning, she doesn't come into the exam room until 8:45. My time's important. So I think I should call her and charge her an office call. I mean, although I was there and she was there, she was just 45 minutes late. So I don't know. So I guess I'm just not the best person, you know, to click on as far as the healthcare, you know, what you need and what you don't need. And, you know, all the spam calls, it is ridiculous, the spam calls that we get for healthcare insurance. That should be against the law. Yeah, I think it's just the insurance companies that are going after older people to get money. I don't know. Not a whole lot of older people got a whole lot of money, if you know what I mean. So it's just a little confusing. I was just kind of like, I was thinking this evening, I think, I'm going to put out a video, but I want to do one on healthcare. Then I'm thinking, well, I'm not the expert on healthcare by any means. You know, it's just very confusing. You know, like I say, it's just, I go in there and I just kind of feel dumber than my diagnosis. Just because I don't know. You know, fill out these forms where you go in, or, you know, you go to a new doctor's and they want you to go in, you know, 15 minutes early to fill out paperwork. And it's always your insurance. I guess they just want to know where their money's coming from, right? That's like I say, that it's, my doctor says I'm fine. The insurance says, hold on, let's not jump to conclusions. Everyone, good luck with your health insurance. See you on the next one.